Okay, good afternoon, everyone. A very warm welcome to our much awaited discussion on men's mental health. We all know that this is a topic which we hardly talk about, and TherapHeal, which is the organization which we have very recently launched in the past month, we want to talk about issues which are pertinent, which are not always talked about. So we thought, why not we start with this? So this is our first live, this is our first panel discussion, and we really look forward to that. We named the panel discussion DisMANtling because we thought it is about, sort of unraveling what men's mental health is all about. And I'm very, very happy to have esteemed panelists in our discussion today. So without further ado, let me just go ahead. So what we did was to understand what men's mental health is all about. We did a brief survey. I would really call it a survey. It is more about, I asked people what are the typical mental health issues they experience. I asked friends, I asked family members, I asked people whom I know, and that is what we all did in our team. And we got a few excerpts on that. So before we start our discussion, I wanted to show you the excerpts of what we got. And then we will hear from one of our fellow, I don't know how to put it, but somebody who is basically representing the men of the new generation and would talk anonymously about his mental health issues. And when he's talking he's basically talk about men's mental health issues in general. So first, let's go and hear from the horse's mouth, and then we will move on to the panel discussion. I'll share my screen. Please let me know if my screen is visible. Is my screen visible?
Yes.
Okay. So see if I can start the. I'm trying to go to the slideshow. I don't know how to minimize it. But the screen is visible, right? If it, I'm not being able to go to the slideshow for some reason, but I hope the screen is visible and the PPT is visible.
The slideshow icon is visible at the base. If you go to the right, you will see there's a small slideshow.
This one, right?
To the right bottom. Yes, that's right.
Okay. Yeah, thank you so much. Okay. So this is DisMANtling, Exploring Men's Mental Health. And we had asked people about typical men's mental health issues. And these people where we had basically approached only male. So let's hear from the horse's mouth. One said that we really have trusted friends whom we can open to transparently and share details of any personal failures or worries. Possibly, we assume a need to be looked upon as always in control. One said that, are we allowed to cry? Cry is always a sign of weakness. The other one said that for men, I think it's the challenge or the expectation to be a perfect son, a perfect father, perfect husband, and a perfect professional, all at the same time, and the social need to also conform to the idea of the alpha male who leads everyone. Another one said, I am a widower, but I have no one, absolutely no one to actually share my grief. I have to put up a strong front. One said, I lost my job in the pandemic, have a 1-year-old baby, no issues financially as my wife is working, yet the society doesn't let me be in peace. So these are all we heard about from people, and I will now request, I'm not naming, I don't know whether his name will be showing, but we have one of our participants who had agreed to share what is his experience of being a man in today's world. So can we please ask him to join?
Yes, I'm online already, and I have no qualms in sharing my name. My name is Shayanth, and I work as a corporate employee in a retail firm. So I actually I would to start with I would like to begin with thanking Dr. Ananya and TherapHeal that They have taken this bold step, this step of not discuss, this step of discussing something which has not been discussed till now, or people have not voiced out what this really means. The moment I hear men's mental health, there's a uh, gender stereotype issue that comes into my mind, uh, because the word of the word men's. Now, mental health is pretty much something that be a problem for anyone. But when we sort the specific issues that men face, I think it has been well summarized by the survey that Dr. Ananya was showing some time back. This overwhelming, while the world is moving towards a genderless, a gender fluid situation where today our fashion is genderless, our jobs are genderless. The way we look at a lot of roles that previously were very divided in men and women are genderless now. In spite of that happening, the role that a man plays in a society, that I think subtly remains where it was, I would say, 10 years back. A man is still, especially in the Indian society, not only in the Indian society, in the rest of the world as well, a man is expected to be the earning, the source of income for the family, and be always, uphold the values of the families. So, financially, emotionally, morally, a man carries a lot of weight on his shoulders, and he has he does not have anyone to share it with. He does not have any friends, or any counsel. I have heard a lot of females, be it female colleagues, be it my female friends, talking about these issues amongst themselves and sorting them out, but I have rarely had a discussion with another man about my personal problems. Or even when I come back home after work, I really discuss my problems with my family. So this burden of delivering day in day out and keeping your problems to yourself, uh, this I think is a issue that needs to be discussed, and that a myth that needs to be challenged. This being number one. Number two, I feel there's a lot of expectation that goes, when it is a man. For example, I was between jobs for 2 months. I did not have a job for 2 months, and in those 2 months, I realized that when people come and ask you about yourself, the second question after asking your name, the second question they ask is, what do you do? And as a man, saying that I do not do anything right now is a very, very difficult task. I question myself then, that why is it difficult to me? Then a lot of unraveling happened in my mind, because of a person who I am, because of the way I have been brought up, because the way we are perceived as social beings in the society. All these points play together at different levels to create our gender identity of a man. And with everything changing, I personally feel we should also look at uh, lessening this burden of, or this moral, this financial burden of a man today. In most of the families, both husband and wife earns, but if a wife loses her job, it is not viewed with the same, you know with the same, it is a lesser impactful incident than a husband losing his job. So this is where I think somewhere these preconceived notions, I think, are some things that we need to break and we need to challenge. And men's mental health is something that we have. I think to start with, I'm sure the experts would speak after this. And I think to start with, most men do not know what mental health issues they're going through. They've always been taught that they are the ones who have to take care of their problems, and they have to solve their own problems without any help, and they keep on trying doing that without seeking help. So I think the first step would be to encourage men, uh, by telling them that they can seek help if there's a problem. They have to understand that yes, this is a problem that I am in now. I am depressed, or I'm not being able to share my problems, and I can uh, go ahead and seek help for these. So I think I have adequately told what my feelings are in as a man, and what are the boundaries that man or does the society has to cross to make the man more comfortable in this society. I think I don't have anything more to add. So over to Dr. Ananya.
Thank you so much. Thank you, Shayan, for having the courage to speak about mental health issues, something which we usually refrain from. Thank you for also sharing your name, which I was initially not sure whether you'll be comfortable, but it's really good to see that you shared about your journey. So this brings us to the beginning of our panel discussion. I'm Dr. Ananya. I am the founder and the chief clinical psychologist of TherapHeal, which is an online mental health platform. And in our panel today on dismantling, exploring mental health, men's mental health, we have our esteemed panelists, Dr. Diptarup, Dr. Noufal, and Dr. Shayanth. Dr. Diptarup and Dr. Noufal had joined from India. Dr. Shayanth had joined from Australia. So thank you so much for joining. The process will be like each speaker will be speaking for about 15 minutes, and then we will have a panel discussion, like a question answer round where you can always ask your question. You will see how we, as a part of the plan, and how we respond to that. So we'll start with Dr. Diptarup. Dr. Diptarup is actually one of my seniors, somebody whom I really look up to. But if I have to introduce him, he's a clinical psychologist by training. He had been working for 1.5 decades as a lecturer, mental health researcher, and lately as a faculty consultant in one of the oldest mental health care institutes in India, which is LGBRIMH. His search for a more socially and personally meaningful practice of psychology led him to travel between the mainstreams and the margins. His travel through critical psychology, positive psychology, to finally settle down with narrative ideas and practices a few years back was both a journey in landscapes of thought as well as in geography. From a small metropolis from a metropolis in South India to a small town in the northeastern India. He completed his master's from Delhi University and later his MPhil and PhD in clinical psychology from NIMHANS, Bangalore. Always restless to do something new, question to the givens and push boundaries, Dr. Deeptarup's current work engagements are influenced by narrative ideas and practices, whether it is coordinating the psychotherapy training program for trainee clinical psychologists or starting a small center for psychological care and community mental health promotion for the college youth called Youth Wellness Hub, aka Hub HUB. So yes, we are all aware of Hub and it's doing wonderfully well. And we are really looking forward to inputs from Dr. Deeptarup, particularly from his perspective of narrative work. So over to you, Dr. Deeptarup. He will be talking about men's mental health through the lens of culture and patriarchy.
Thank you so much, Ananya. And it's nice to see old faces of Nimans back here on the screen in a miniature version. Um, uh, I was just thinking as I was reflecting on the topic that you had asked me to talk about today. I was thinking about fish in an aquarium or fish in the water. And I was just thinking, if I interview a fish and ask the fish what it is to be in, how does the water looks like? How does the water feel like? Can you describe it? And possibly the fish will answer, what is water? I don't know what is water. Obviously, because of the fact that the fish is all the time inside it. And that was the first thing that came to my mind when I was thinking about this two topic or these two concepts, two ideas, two lenses that you have asked me to look at. One is the lens of culture and the other one is the lens of gender or patriarchy in general. And I couldn't help but think myself as the fish. And I was wondering, how am I going to talk about men's mental health? Because I've never thought that there needs to be a lens to look at the mental health of a man. All the while, because I have never thought that there could be possibly a different lens of that. And I was also thinking about culture. Thankfully, culture, in a way, it's easier for me to start with, because the location of my place and my work privileges me to come in contact and in the interface of culture, a variety of culture, some of it which I understand, many of it which I don't understand. So if you are thrown into a place where you have to make sense of things which you don't know, you start efforting towards that. So that way speaking, culture is still a easier one for me. But before I come into my own experience as a mental health professional, as a supervisor, as a learner in psychology, a lifelong learner, or 1.5 decades sounds for a pretty long time. Uh, I would say I'd just like to locate this conversation by bringing in the relationship between psychology and culture, and then psychology and gender, because that will create a groundwork or the context of some of the responses that came up right at the beginning. Now, if you look at culture, a simple definition of culture is a way of knowing, constructing the world and others. With this simple definition of Brunner, if it is such a huge thing, if it is a lens through which we are looking at it, if you look at the relationship of psychology as a discipline and culture, you will see that the relationship has been always a very problematic or troubling relationship. It's in a way vexed or complicated. Why? Because for a long time, culture was irrelevant for psychology as a discipline. And then after a while, if you look at history of psychology, you will see that suddenly when other disciplines emerged, sociology and ethnography started looking at culture in a more serious way, and possibly psychology thought that, well, I also am a social science, possibly. It started looking at culture as a variable, as a source of variability. That's the reason culture is a variable. We still have a lot of research showing a particular aspect of a culture as a variable in a typical empirical research. Now, source of variability is what we consider culture as. But then there has been some subdisciplines of psychology which realize that it cannot be a source of variability, but maybe culture is constitutive of the psyche. And that makes it much more interesting and complex. If culture is constitutive of psyche, how can I understand psyche without understanding culture? How can a fish understand who he or she is without knowing the water? Now, that said and done, the methodologies or the history of tools that psychology has gathered in understanding culture or studying culture has been really difficult. Because cultural difference arguments, which is the most popular argument, as I've been mentioning, has either considered Western as the universal. So if that is the benchmark, whatever we do, let's check with the benchmark. Or the other way of looking at culture or understand culture and mental health in that, for that matter, is cultural variant of that universal. So if that is essentially a Western universal notion, and as it is traveling 10,000 kilometers or 5,000 kilometers, how does it get changed? Because of geographical location, because of the way we think, eat, food, and all those things. So it is essentially a variant, a cultural variant of the universal West. Now, another very interesting way is to look at, well, we don't consider West as the universal. We have nothing to do because there is no meeting point, and East is East and West is West, and let's focus on East. We see it, how it is happening in some extreme forms, in a way of rigid way of looking at it. but this is one way of looking at it. And the fourth one, that could be one way of possibly learning, is where there's a debate or a dialogue that continues, where we look at what does culture do to us, or what do we do to culture, and whether the West that we're talking about is also a particular culture and a native culture of the West, and ours being a native culture in the East. Now, if you look at the understanding of culture, or the lens, if you use this as the lens of culture, then every mental health aspect, every mental health description, every symptomatology that we are looking at is going to get contested, because we are not at one platform to say, oh, this is this. Now, quickly going to the aspect of gender or patriarchy. Now, I was mentioning about that for a long time, well, obviously, masculinity and men's mental health has been an issue for critical psychologists. And I have been a student of critical psychology for that matter. But it takes a while for a man like me to become aware of, quote unquote, the manliness or the manhood of it. And when I was looking at it, I realized, first of all, I thought, well, what typical way of looking at it is that, what is psychology of men? Well, psychology is always for men, by men, of men. So what is the point in talking about psychology of men? But then I realized, and I wanted to emphasize the fact, the moment we start talking about psychology of men and not just psychology, we are not taking men as the reference point, men as the norm setting for granted thing. And that's the difference, that's the change. So if men is like another way of looking at a specific culture, or another point that we need to understand, we need to learn, we need to know, and it is not a normative referencing a benchmark, but a complex nuanced concept, then the traditional norm with patriarchy, traditional norm with men's mental health and masculinity, like what we discussed about toughness, or lack of ability to, not able to share one's emotions, and independence, which we inherit as the traditional norms, and then the need to adhere to it. And as we all know, need to adhere to control is one of the major source of domestic violence, of men's violence over women, of husbands' violence over of wives, of use of substance use, of being a detached father. And that becomes a perplexing question. So for me, at a personal level, the first difficult aspect of men's masculinity that hit me personally was when my daughter was born 11 and a half years back in Bangalore, and I had to suddenly think what kind of father I want to be, what kind of fathers that I see around, what kind of fathers that I got, that I saw in my own life. And that's where it became difficult for me to understand or to find answers, because I was looking for easy answers. So rather than being given a given notion of who I can be as a father, to being a given notion of being a therapist, that is being a male therapist, where the male is more of a sex, biological sex, rather than a psychosocial idea or the gender notion of it. Once I start thinking of it, then I start looking at it or putting myself under the microscope. And the more I put myself as a microscope, some of the questions, some of the issues become evident in front of me. Same is the case for with the patients that I work with. So they are no longer just patients, but patients who carry things with them which I need to use my own lenses, and when needed, I need to change my lenses. So these are the starting remarks with which I wanted to put forward or create the context of this conversation or dialogue, where a comfortable one answer or specific answer has been eluding me as I started thinking of talking about men's mental health and masculinity.
Thank you so much. Thank you for that enlightening introduction to the concept. And so basically, when I was teaching at Christ University, and one of my students did a research on stay-at-home dads, and that is probably one of the research where culture came out so strongly, where this aspect of autonomy to choose to be a stay-at-home dad versus whether we really have that autonomy, and then the concept of relational autonomy and cultural autonomy, where people around sort of step in and they'd want to decide whether it is right or wrong. That is the first time probably I started thinking about how culture plays such a strong role when it comes to understanding what we are capable of doing as, and how gender and culture sort of so strongly impacts. And we, from like being a female, my lens had always, whenever, even if I've talked about gender, I know I've been a bit inclined towards understanding things from the lens of females. But it was probably with this research that I started rethinking the entire process. And I love the example that you give of being fish in the water. And the fish is always in the water. And when, as males, you think of men's mental health, how that comes in. And that's why probably I wanted to hear from all the male mental health practitioners. So thank you for initiating the conversation. We'll, of course, come back to you when once we hear from others, and when we are doing the question answer round, we'll of course come back to you, and we'll ask more questions. So thank you so much, Dr. Diptarup. And we will now move on to our next speaker, Dr. Noufal. Dr. Noufal is also, I'll just make him the thing. 1 second. I'm just bringing the highlight on him. Yeah. So hello, Dr. Noufal, and he's a very dear colleague. I think we are all from NIMHANS. It's almost like a NIMHANS reunion for all of us. So Dr. Noufal is, right now, he's a clinical psychologist at IIM Kozhikode. But if I have to introduce him, he has done his PG in Applied Psychology from Pondicherry Central University, and his MPhil in Clinical Psychology from CIP Ranchi, and his PhD from NIMHANS. He is a NET JRF fellow from UGC. He had worked as Disability Management Officer in a Kerala government-run rehabilitation program, and has worked as a clinical psychologist come in charge for an NGO in Thanal, Kozhikode. And at present, as I told you, he's working in IIM Kozhikode, the Institute of Indian Institute of Management, Kozhikode. He is interested in positive psychology like Dr. Diptarup, and as well as mental health promotion, mindfulness, and acceptance approaches, spirituality, and also in mentoring emerging professionals and in research. We all know that he is how committed he is in mental health promotion with his active participation in LinkedIn. We all, whoever is in LinkedIn will probably know him. He's almost like a LinkedIn celebrity. And he, apart from that, likes to read, play, and keep to himself as much as possible. So despite that you have agreed to be here and share, like despite liking to keep to yourself, I know it was quite a discussion when we were thinking whether you will come on video live. So thank you for agreeing to be a part of the panel. So from Dr. Noufal, we will hear about the psychological factors that lead to mental health concerns in men. Over to you, Dr. Noufal.
Thank you, Dr. Ananya. Am I audible? Somebody can help me.
Yes, you're absolutely audible.
Oh,
yes.
okay. And I'm really glad to see Dr. Diptarup and Dr. Shayanth. Here we have been in the NIMHANS at the same time. And thank you so much, Dr. Ananya, for the invite and the opportunity to talk. When I was actually thinking of this topic, dismantling men's mental health, I have almost similar thoughts as Dr. Diptarup had. Maybe we had the same mentoring PhD probably, that is why. I just wanted to start with an anecdotal story that when I was a child, I used to watch movies very rarely though, and there would have been time when we sit in the same house and we would watch a lot of kids watching movies, and I remember me myself doing. after watching a particularly very emotionally provocative movie, we used to pride, especially the boys used to pride that we did not cry watching the movie, and we used to feel sorry if I say the word, girls, or women, crying to emotionally evoking movies, scenes and all. Though of course that time I was quite ignorant what was happening, and I was wondering how it has changed over a period of time when I came into this field of mental health and all. So what I would want to tell in the first and foremost thing is that the first thing to remember is that in our efforts to dig deeper, to be precise, and to understand the phenomena in depth, especially a phenomena like mental health, we tend to make categorizations that many times do not make much sense. For example, after all, men, women, transgenders, or any gender for that matter, is a variation, in several aspects of being human. So it is one aspect of who we are as a human being, our gender, not necessarily the only aspect of our existence. And what in that way, what makes our life better, what contributes to our well-being, more or less remains similar. I usually keep it as that, where masculine ends and femininity begins, or vice versa, there is no surety as such. So a dichotomy of gender, considering in an area where we live, gender is fluid means it is continuous, and there is no ending or beginning. uh, it is to be taken with a pinch of salt when we discuss men's mental health. That is one thing I want to share. And I particularly like Dr. Diptarup's analogy of a fish in the water. Just like him, even in the beginning, even I didn't think that we need a different lens to look into men's mental health. Probably if we looked at the fish, a male fish or a female fish and a transgender fish, probably if we looked into the fish as such, there might not have been a lot of differences in their mental health per se. But as he quite eloquently pointed out, if we add the water part and which water, what type of water they live in, I think makes a lot of differences. That way, if we add the culture, the nature part of life into our mental health, I think there are differences. Then again, something I would want again to remind is that these differences to some extent are perceived ones or learned ones than biologically in origin. Of course, it is not to be mistaken that something is learned doesn't mean that it is any lesser. Sometimes learning is so deeply ingrained in our being, in our psyche, that they just feel like our genetic involvement or genetic endowment. So that is something that we need to keep in mind. Even though if we look into the psychological aspects of men and women, or gender differences in that, there are three things that anybody would want to keep in mind. One is that if we consider mental health among men and women, one difference that we can see is that there is a differences in condition prevalence and suicide rates. For example, what kind of mental health illnesses, what kind of mental health conditions, how many, in how frequent, at what age, so there is differences in men and women in the existence, prevalence, and epidemiological data of the various mental health conditions. I'm pretty sure Dr. Shayanth will be covering that part. Just to briefly point out a couple of points is that in general, women are more likely to experience mental health condition than men, and they're also highly likely to attempt suicide than men. Though, if we look into the completed suicide, men are more likely, for example, 4 times likely than a woman to complete a suicide. It is attributed to the lethality of the means. The second difference between men and women, when we look into men's mental health, that what differentiate them from women is that men's issue compared to women's mental health issue can develop from different causes and triggers than those affecting women. For example, as Dr. Diptarup had very quickly pointed out, that it can have an origin in societal expectations and the traditional gender roles, which may lead to make them think that, for example, they have to be the breadwinners of the family, and just like that person, I forgot his name. I'm really sorry. He said that he is not working. He is in a particularly healthy position financially, but his wife is working. But his wife is working, not him is working, is the issue for many people. So even though the family in particular may be comfortable with the male partner not working, the society may not be liking it, and somewhere many men are forced to listen to that different narration, and they may feel that wrath of the society that way. And of course, men are supposed not to cry. At least that is what people used to believe. Men can and men should and men will cry, is what I understand. even though displaying traditional masculine roles, that I have to be strong, I have to be in control, I have to be the center of the strength in the family. If I have to be strong, then it automatically by default means that I cannot cry, I cannot seek help, I cannot talk to people about my difficulties or my vulnerabilities also foreseen. And that would lead to the third difference in men's mental health compared to women's mental health is their reluctance to seek professional help. Men worldwide, in India, across any place where studies are conducted on health seeking for mental health, it is found that men are far less likely than women to seek treatment for issues such as depression or substance abuse or anxiety or any kind of psychiatric conditions. And again, this is due to social norms. Of course, men cannot cry is what we keep believing, and of course, and added to that, a reluctance to talk, as well as to a great extent, many men tend to downplay their symptoms. Is also is quite, they think, it is nothing, it will go away, it is nothing compared to what other people are going through. So that is also a difference that we might want to see. And if you look specifically into, if we take men and their mental health, and if you look among men who are at high risk compared to other men, a few categories have emerged. These are based on the studies from the Western world. So, we have to be careful about how we apply that to the Indian context, where the culture is a significant part. For example, it is found that older white men above the age of 85 are extremely highly likely to experience mental health condition as well as completing suicide. Men who have experienced one or other type of trauma are at high risk of men who have not experienced. Then, compared to women, men experiencing employment issues are at higher risk of mental health condition than men who have had a marital breakdown, men who are undergoing divorce or separation. In fact, there are several studies which suggest that being single is a very significant contributor to completed suicide among human beings, among individuals, especially among men. And compared to women, men who are in some kind of legal or financial concerns, they are highly likely to have develop or exacerbate their existing mental health condition. Then men have a higher tendency to use or abuse or misuse or become dependent on drugs, various kinds of illicit drugs as well as alcohol use. Then men with a family history of mental health issues like any other gender, they are also at higher risk of mental health condition. And of course, I think it would be similar for women also. Experience of any kind of physical health condition, or conflict with the family or friends are also something that puts men at a higher risk of mental illness or mental health conditions. But if we look into these aspects alone, this would say that these are in general about mental illness, and we all know that mental health is not just the absence of mental illness, but the presence of a number of positive attributes. Unfortunately, if you look into mental health as a comprehensive terminology, a comprehensive entity which includes positive mental health, then we see that compared to studies on gender differences in mental illness, there are very few studies that are done on mental health differences in psychological well-being in general. And those studies when they are done, which is very few, they have the studies, the differences that they show are quite inconsistent in their outcomes. One thing that we need to keep in mind again is that most societies, I think that is something that all of us are aware of. Most societies consider men and women are essentially different and they should occupy different roles. While research has not supported that these two genders are significantly different in most psychological traits. Of course, there will be differences, but not as much differences as the society as a whole would believe it to be. And very few things in general as of now shows significant gender differences. And in that, one important difference that women has compared to men in terms of psychological well-being that is shown across several studies is that women reported having more positive and negative emotion with greater frequency and intensity than men. So women in general experience more positive and negative emotions with greater frequency and intensity than men. And though if you look deeper into any of these studies, something that keeps repeated, something that keeps appearing again and again is the role that the age culture and the gender role has played. So when we look into, if you go back to the analogy that Dr. Diptarup mentioned, if you go back to the fishes in the pond, in the sea, and if you look into fishes as fishes alone, maybe the gender may not make a big difference. But if you look into the society, the roles that they're assigned to, the roles that the society expects out of them, the way the water perceives, treats these many different fishes, I am pretty sure that will be entirely different scenario. And also, I just wanted to I just wanted to make it a point that popular titles like men are from Mars and women are from Venus, well, they are popular titles than psychological facts, because I usually believe dismantling, diswomanting, dishumanizing. Ultimately, mental health is something that exists in a continuum. Gender is something that is existing in a continuum. While we need to understand, differentiate men, women, transgenders, and all the possible genders in between, and how this gender role plays an important role in their mental health and the way mental health is experienced. We also need to reduce that artificial dichotomies and artificial categorization, so that we move closer and closer to achieving optimal mental health irrespective of the gender. So I hope discussions like this will add to our efforts at improving understanding our understanding our improving our understanding about men and their mental health. And I'm not assuming for even a second that we must not discuss about men's mental health. We need to discuss it separately, definitely, because that is something that has not been discussed as a legitimate aspect of mental health discussions. So we need it not because that should have been there, but because it is there. And when it is there, we need to give its due importance. And I hope over a period of time, discussions like this and much more to come will help us to remove that gender as a part of defining one's mental health and illness and mental health condition. And thank you so much for the patient listening.
Thank you so much, Dr. Noufal. That was a very powerful message from your side, where you said that gender and the perceived gender roles, everything is on a continuum. And all these stereotyping that men are from Mars and women are from Venus, these are not at all psychologically there is no psychological fact in it. These are like concepts and stereotypes, and I'm glad that you brought it up, and all very fact-based, research-based inputs, but a very, very powerful message from your side. So thank you so much for sharing your inputs. We'll again come back to you when we are discussing the questions. So I'll now move on to Dr. Shayanth. Dr. Shayanth, I'm just trying to again put him in the highlight. 1 sec. Yeah. So Dr. Shayanth is, again, thank you so much from joining all the way from Australia. I know this is a time which it's difficult. It's probably nighttime there, but yet you agreed to talk about it and you were very enthusiastic about talking about this topic. So thank you for joining. So to introduce him, Dr. Shayanth, again, an Enhance alumni. So he's currently employed as a senior registrar at Northwestern Mental Health at Melbourne. And he also has experience as a consultant psychiatrist at Lotus Multi-Speciality Hospital. I think that is in Bangalore, right? Okay. He has the experience in an OPD clinic to oversee and supervise working and training of junior residents. And also he had been involved in training and teaching in psychiatric nursing, MPhil courses, supervising psychiatrists. He's also somebody who has done his PDF from NIMHANS. So you have done your PDF also from NIMHANS, right? I don't know your topic of PDF, but I understand that you had been very much involved in training, as well as you worked as a senior resident, and you had extreme psychiatric exposure. So we wanted to hear from a psychiatrist the typical mental health concerns, particularly the mental health disorders that are mostly seen in men. And also, if you want to add something in terms of how we can identify them earlier, how we can prevent them. And if I've missed something from your introduction, which is important, I'm sorry about that. If you can always share that with us.
Thank
so
you,
over to
Ananya,
you. Over to you, Dr. Shah. Yeah.
Thank you, Ananya, for giving this opportunity to speak. And I think both the other speakers have covered most of the things and not left much for me to speak. When I first heard about this topic, when Pratibha first mentioned about this topic of men's mental health, the first thing I was wondering was, what do I know? Do I know anything extra about men's mental health? Because technically we are not tuned to, or we don't really look about. Again, when we are practicing, we tend to see both the gender patients, and we don't really differentiate in terms of gender when the patient comes in. But we often don't really speak about men's mental health as much as we do about women's mental health. And also it is the clinicians kind of bias and lack of awareness. And then when you mentioned about this topic, it made me more curious to go through about and self-reflect of what I've seen during the practice and what I've learned, and then also did my little extra research to again to refresh, because again, like I said, like we don't really speak much about men's mental health. Like Noufal has mentioned, again, when we look at the more psychiatric morbidity compared to male to female, again, the psychiatric morbidity is greater in men compared to females. Again, when we look at what are the different kinds of prevalence differences in terms of psychiatric manifestations or presentations, is that like we see more substance use disorders, whether it can be use of nicotine as a smoking or use of cannabis, alcohol, and a lot of the substance use disorders are slightly higher in male, quite significantly higher in male compared to female. This is the one topic which we usually also see more as a presentation. And the next subsequent things which we see more often in male are the severe mental health disorders, like either it can be like psychosis, schizophrenia, bipolar affective disorders, again, the lot of childhood developmental disorders like autism spectrum disorder, ADHD, or the conduct disorders. These are the most common psychiatric disorders which we see in men or males, compared to females, where we see more of common mental disorders like anxiety disorders, depression, again, OCD, or a lot of different anxiety spectrum related disorders. Then I was wondering again, like Noufal mentioned, when we look at the rate of suicides or the rate of completed suicide, there is a marked difference between men and women. Again, there is the significantly higher rates of suicide in completed suicide in men compared to females. But when as I mentioned, when we look at the data on either it can be anxiety disorders or depression, it shows that it is more in females. Why is that? There is a marked difference. Suicide rates are higher and all, but whereas we say that anxiety and depressions are lower. Then again, I was like more curious, like why is it? And also we attribute the majority of the contribution to suicide attempts as one of the presence of either psychiatric illness or significant life event or stressors. And then again, when the other difficulty is that we tend to, when we are diagnosing someone, we tend to have a specific criterias based on either presence or absence of those criteria. We tend to diagnose psychiatric disorder. If they don't meet that specific criteria of not having like more than 5 symptoms out of 10 symptoms or more than 6 symptoms out of 10 symptoms, we don't really diagnose them of having psychiatric disorder. That is one of the drawbacks and a lot of debate which are happening about the current diagnostic systems, and I don't want to go much deeper into that. And again, when we look at those specific symptoms, is it more, does it represent both the genders is the other question, because few of the symptoms manifestation, there is a large difference in terms of symptoms manifestation across both the genders. Like the typical symptoms of either anxiety or depression, when we look at low mood, loss of interest, those things might not be present or in men, or even if it is present, it can be varied presentation. Like I was saying, in men we see more of anger related issues or use of substance, but we tend to diagnose those aspects, but probably we don't really uh, go into the underlying psychopathology or underlying the contributing factors which has led to use of either anger or substance use. Again, most of the times this depression and anxiety gets masked or because of the presentation, like either anger or use of substance. And then other thing which I was again wanted to mention is, like both of the other speakers have definitely covered about the role of masculinity and the societal role of what to expect from male, has largely contributed to this very presentation. Again, expression of either anxiety or depression is viewed in the society as the feminine or feministic kind of characters. So, and also men are tuned to not seek help when they are having difficulty. When Shayan was mentioning, like again, I was reflecting many of those specific again things during the encounters which I have seen in my practice. About he spoke about a lot of different aspects of the life again which we see during the men's mental health presentation. He spoke about unemployment again, which is again viewed in our society or across different society as a thing which again provides a lot of self-esteem, self-identity, and the role of breadwinner, and to support not just him, to his entire family. When that is affected, that is one of the main specific trigger which again provokes or incites depression. We tend to see a lot of depressive symptoms or anxiety symptoms across various life cycles or various stages of life. And it can be again to do the main stressors again compared in terms of stressful situation differences which I can notice was, one is again presence unemployment. The second thing is not having a support, enough social support, or like either divorce or uh, breakup in romantic relationships. And even the fatherhood is technically seen more specific as more specific stressors. We again speak a lot about postpartum depression or antenatal depression. The same thing is also seen in men as well, like postpartum parental postpartum depression, because fatherhood itself again increases that sense of responsibility of having one more family member, that which increases the responsibility in men. I think we need to be more aware and about the presence of psychiatric illness in male as well. And if we study main things about the prevalence, we tend to get more biased of, only these things we can expect from men, like either use of substance or anger issues or the severe mental disorder, and we tend to overlook the other most common aspects which men don't really present by themselves. Thank you.
Thank you so much, Dr. Shayanth, for a very insightful description of men's psychiatric issues. And I must say that when I was hearing Dr. Noufal, I think he was talking about there being, like, the research shows that females have more reported mental health concerns, or they're probably more prone to have mental health issues. But you very beautifully talked about what might be the reasons. And that was actually one question that was going on in my mind. And more so, when you started off, you said that, either substance abuse or smoking or severe mental health issues, these are the ones which are mostly reported. And we don't talk about the other ones in male. So I think we have raised very, very pertinent questions. You've talked about the importance of social support, about unemployment and other issues, like particularly divorce and other factors that come in. So thank you so much for sharing your views. We will now open this for a question answer round. I will request all of you to please type in your question in the chat box, or if you want to speak, you can unmute yourself and ask the question. But I would request you all to try and type your questions in the chat box. And while you type your question, I will ask others to be a part of the panel. So just give me 1 second. I am trying to again bring you all to the highlight. Yes, so we all have all our panel members here. So I think the one thing that when I was hearing you all, one thing that stayed with me is how social, like, and even when I was actually, when I did the survey, when I heard their responses, even when I was hearing out to Cheyenne, somewhere it is about, will this be accepted? Will I don't have a friend. There was some level of, whom will I share it with? Can I really share? Do I have people with whom I can trust? There was one participant from the survey, he used the word trust. Do I have a trustworthy friend with whom I can open up and share? And there are things, when we talk about loneliness and other things, these are, when we talk about loneliness, somewhere in our mind, we have this social construct or a perception that it is more a feminine thing, that you're like crying is very stereotyped, maybe being lonely, not working. These are like, being lonely is something which is more feminine. You are the male, you are the, somebody said that the alpha, we have to be the alpha. So my question to the panel, and we can start with Dr. Diptarup, how do you think people can respond to that? How can we, like, as an individual, how can we respond to that as males? And how can others support it? How can others really change this perception so that we can actually make a world which is more, which normalizes men's mental health issues? And even if we don't call them mental health issues, which doesn't really follow certain stereotypes. Over to you, Dr. Deeptharu.
I'll start with a very quick answer. I think it's quite evident that all the panelists, either directly or indirectly, all of us are not sitting very well with the dichotomy of men and women in the very universalist pattern. And Dr. Noufal very rightly pointed out the name of the book, which is now a very common thing to differentiate how I'm different from my wife, or how my daughter is different from my son. So basically what we need to look at is, we need to look at how is these ideas are resulting in a discourse of polarity. Polarity of men versus women, polarity of diagnosis, which is legitimate, and something which is, if not diagnosed, then the distress may not be legitimate to be talked about as a mental health concern. So if it fulfills 6 criteria out of 10, then it's under my purview and all those things. So as long as we are going to work with polarities, we will have very simple, straightforward, in a way, decisions to make. But what if we try to disrupt the politics of this polarity, and like and try to look for the in-between spaces? Because looking for in-between spaces requires a lot of unlearning. So narrative practices in my life has brought in a new perspective by questioning the givens of my training, of looking at things as it is rather than questioning. So looking at in-between places between the polarities is where new conversations and new possibilities that might come up. So so I might see a man in a woman, or a woman in a man, or something completely new as I am interacting with somebody and trying to understand that person's distress. So so for me, as a therapist or somebody, I would rather like to look at the symptoms, not just as symptoms, but as a response to something that is happening around them. So the fish is responding to the water that has got polluted, and it has developed a thick greenish slime on its body, which unfortunately is the true thing if you look at the ocean's pollution. So now, now is this the problem of the fish?
Sorry, I was on mute. So thank you for beautifully highlighting that the first step probably is to question the dichotomy. We always tend to think men, and that is where, like, somewhere we have that almost ingrained in our systems, and which is unfortunately still propagated at so many different levels. But if we at our individual level start to question that and see these as responses rather than gender-based norms or symptoms, but more about response to the situation, then it will be more about human responses to certain situation, and that will definitely enhance the acceptability. So thank you, Dr. Diptarup. Dr. Noufal or Dr. Shayanth, would you like to add something else to this point?
I think maybe a thought to add to what Dr. Diptarup has very eloquently, beautifully pointed out is that we definitely, as again I think I agree with him that all of us agree with that that resistance part to the dichotomy part, or any kind of discrete categorization of humanity.
Is he audible?
Categorization of humanity. Yet.
Yeah, I think Dr. Noufal, you were breaking for a while, but yes. Can you just...
Am I audible? Am I audible now?
Yeah. You are audible.
Yeah. So I was saying that we need to definitely question the artificial dichotomies and discretingly putting people into different gender-based roles. But at the same time, we need to look deeply into and understand, acknowledge the dichotomy that is already existing. Because sometimes what we do is that we come across the right piece of information that gender is a fluid one, so that we may hurry to looking into the equality based understanding of mental health that might leave men behind. Because even though we say that history is, I have heard this quote before, that why history is his story, not her story. I think it is because he wrote the story, that is why it's history. And unfortunately, I think in the case of mental health, though woman has been on the side of receiving side of so many different kinds of oppressions and all across millennia, in terms of mental health, I think men have probably always been on the backside of their mental health that way. So I think if we need to deal with this gap in mental health between different genders, one thing definitely is to us, Dr. Diptarup put and Dr. Shayanth put, that we need to question that dichotomy, but also at the same time there is a dichotomy that is present, and we need to look at it deeply, we need to understand it, and at the same time question about I understand that it is there, I understand, I study about it, and I try to deal with it. At the same time, I also look into that I don't want to continue that dichotomy. So we need to have a bifurcated way of approaching these gender differences in mental health is what I feel. And of course, like any change, even talking about mental health, men's mental health or women's mental health, for them it has to have an individual side of work as well as a systemic level of change. So we do individually what we can do from outside, and the system, let the system change. And usually when individuals change, the system reciprocates. And I feel continuously engaging in conversations, and I have always seen people underestimating the power of open forums and discussions. I cannot overemphasize, even if I want to, I cannot exaggerate, even if I want to, the impact of open forums like this in dismantling these kind of myths, or dismantling these kinds of unhealthy ways of looking at society. So I feel to a great extent, and even I work in the area of mental health promotion, so I have come across several years how beautiful, how strong, and how powerful general discussions about these topics would do. So I think that would be also an important aspect of dealing with this gender gap or gap in men's mental health, and how we will deal with it. And just my thoughts on that. Thank you so much. You're on mute, Dr. Ananya.
Yeah, thank you. So thanks for pointing that out. Yeah, so I was saying that that's again a very, very impactful statement when you say that as the individual changes, the society reciprocates. We often underestimate the value of an individual voice, and we always think that even if I think differently, what difference does it make? But it does make a difference, and that is the first step that we can take, and thanks for pointing that out. Dr. Shayanth, you had experience in working in national institutes and private hospitals in India and in Australia, and of course you have a very multicultural experience. And so I was wondering if you could in your experience, did you see any difference in the way people from the different countries or maybe different backgrounds, even like you had seen clients in private setup and in government setup, do you see any difference in the client profile and their perception? Particularly, I'm talking about men's mental health and from a cultural perspective. Did you notice any difference? More in terms of they coming up, talking about their issues and being open in terms of sharing their concerns. You're also on mute, Dr. Shah. Yeah, thank you.
No, thank you. Like I've seen both the culture like across India as well as Australia, but when we look at a larger perspective, I don't really see much change in like either in terms of presentation or the perception in terms of men's mental health across. Like I was mentioning, even in my brief initial discussion, there is a lot of changes in the way we, through the cultural influence on either reporting of troubles or like reporting of the issues or seeking treatment. I don't really see a much change. I think speaking more in terms of like in such forums about the men's mental health issues, it creates a lot of awareness among men, saying that they're not alone, or there are a lot more other men who are also experiencing similar difficulties. And the other thing is, like, even if they experience difficulties, to come forward and seek help, it is nothing to do with their masculinity, or it has again it both are not linked, though we tend to bring everything back to the masculinity or being strong, or show like expression of anxiety or depression as a sign of weakness. It technically both are not definitely linked. And other thing is also about speaking more about such topics is even it creates a lot of awareness among the clinicians as well, that there is a significant difference in terms of perception of the stress, the way we perceive the stress and the way we react to stress. And even when somebody presents with different problems, either it, like I was mentioning about substance use or about any other behavioral related issues, we always need to check for underlying issues such as anxiety, depression, which we tend to overlook in men.
Right. Thank you. So, Dr. Shayanth, you pointed out something like the importance of underlying issues, where we tend to sort of, in most cases, tend to go in terms of symptoms, what are the things, criteria. But what you are also highlighting is we need to go beyond the symptoms, and we need to see that there are probably things and issues which are not reported as much, and we need to explore that. Fine. As a therapist, another challenge which I often face, and this probably will be the last question from my side, and then I'll ask for some last minute tips from you. I often see that when I talk about self-care with my male clients, there's always like, what self-care? The approach, or even in therapy, I see, and I can't generalize, but it's based on my experience. Men want more like, okay, you tell us the solutions, more about, no, not really into exploring what we need to do. We have to sort of this is the problem, I need to get the solution. and don't talk about self-care. That seems like not our thing. Uh, how important do you think is self-care? Again, I know that we have come to a point where we don't want to get into the dichotomous understanding of gender, but since still we are talking about men's mental health, how important do you think is self-care among men, and how can they actually engage in self-care? Any of you can take the question. Yes, Dr. Noufal, you want to respond?
Yeah, so a couple of thoughts too. One, I think one thing I forgot to mention in my presentation also was that I think Dr. Shayanth mentioned it. I just wanted to re-emphasize that we have a strong bias in diagnosing. I think men and women and various mental health conditions, and every assumption, every piece of knowledge that we have about gender differences among men and women. I'm just using this dichotomy because other genders we are not yet aware of how their mental health or something. What I realize is that this is based on the information that is available to us, and what we have got, and what is remaining in the whole is, I think, is much more different. So when we get to know more and more, men come to the forefront of mental health help seeking, and when they start sharing their experience, maybe what we understand as the differences and what we understand as the all those male female differentiation might disappear, or maybe something new might emerge, because what we all know is, to a great extent, based on large scale information from women participants in a lot of researches and a lot of clinical studies, and very few male participants. So that is what, and I just wanted to re-emphasize the fact that our information regarding gender differences in men's and women's mental health is a biased one, is to my understanding. And also, coming to self-care, self-care is, I think, the foundation, the fundamental of taking care of mental health, irrespective of the gender. And self-care, many times people mistake that self-care is only about caring one's own self. It is true, but self do not exist in the vacuum. So self-care is in some way other care also. So somewhere, I think, a person who takes care of himself, herself, or their self is somebody who will be growing, while at the same time allowing the society, the system, the environment around him or her to to grow and flourish. So self-care, I have always felt, if there comes an ideal situation where I can give single therapy to all the transdiagnostically, I would have said that maybe start with the self-care, because I feel self-care at the core of any therapeutic intervention. Self-care is something, of course, how we reach to that self-care point might differ, but I think self-care is, for me personally, at least, if I'm wrong, anybody else you can correct me. For me, self care is a mental health, because self care starts, it thrives and it ends with one's growth, and I feel that that is what we're looking for in terms of mental health also. I just wanted to put it very shortly that we cannot, again I use the word exaggerate, we cannot exaggerate the importance of self care, because it is the foundation, the fundamental. Thank you.
Thank you. Thank you for emphasizing the importance of self-care, and that self is self. It is not something, it cannot be put under the boundaries and the categories of gender, which anyway we now know is real. There are no categories. It's more of a continuum. Dr. Diptarup or Dr. Shayanth, would you like to add anything to this point? Yes, Dr. Diptarup.
Yes, there is no questioning about the importance of self-care, and as Noufal rightly pointed out. But at the same time, what Ananya, you were mentioning is about the difficulty in dialoguing with your clients about self-care, which is truth, which is reality. So the question then for us is that what makes or what creates this gap? And a reflection about the general discourse of self and self-care around us will quickly give us an idea that the idea or the discourse of self-care is something which is not generally associated with males, with men. So it is there, let me use the term idioms of distress, the way we talk about idioms of distress or expressions of distress between various genders, between various cultures. So similarly, the ways one express about one's need to take care of themselves is different. So if you ask openly, directly about self-care, maybe it's a difficult thing for our male clients to talk or respond to it. But then essentially at the root of any engagement that they do, even the fact that they're coming and talking to you, deep buried in it is the fundamental aspect of taking care of their selves. And the constitution of their selves could be not just them, it can be their work, their career, their family, their friends. So finding out the language and finding out and possibly providing them with the vocabularies, with discourses where words and expressions are easier for them to talk about or to share, is the skill. But self-care, it's an absolute thing.
You're again on mute, Dr. Ananya.
Thanks for reminding me. I'm like forgetting every time. Yeah, so thank you for emphasizing on that. And we have one question. And I also saw somebody raising her hand. Divya, I guess, can you just raise your hand again? I'll give you a chance to ask the question. So I think we have just one question. And she's asking, my question is in the lines of Dr. Ananya. I don't know if I have a proper representation. In my work with male clients, I have found resistance in working with emotions relatively, wondering if the difference could be that it's coming from a female therapist and I'm expecting it to work from a female therapist lens. Any thoughts on the same? Yes, anybody would like to take that question?
Is it okay if I go first?
Yes, yes, please.
Just that, one thing I wanted to ask to add to Dr. Diptarup is that, when it comes to self-care, a quick point is that it is an anecdote from my own experience with one of my clients. So I told my client, I usually use, phrases and idioms as, Diptarup said that. I told him, you need to sit down, sometimes you need to sit down and rest. And this was his response. His response was that, no, I am this one that is standing so that others can sit. So I was remembering that when we talk about, the self-care part. I think men and mothers, these are the two groups of people who find self-care to be very difficult, because somewhere we have been placed them in a kind of place where they are the one through whom the whole entire community works, and they somehow believe that I cannot sit down. If I sit down, there are so many leaning onto me, I cannot say I cannot afford to sit. And I think when it comes to self-care among men, and I think much more in mothers also, this is the narrative: I cannot afford to self-care, because self-care would mean that I take my own time for myself to do things for my own betterment, and I cannot do anything about that. So that is one thing. And expressing emotions, I think as a male therapist, I have had a quite number of male clients, and I find the similar experience as I think it was Padmaja who was sharing that there is a huge significant difficulty with men sharing their experiences, the emotional experiences. Their narratives verbally is eloquent, is clear, is very what we say descriptive, and even concerns at the same time that they're very what we say planned in expressing their experiences in a language, in a verbal way, but the emotions many times I feel missing. And I think again it has to do with the way we have been treated. For example, I shared my story. I learned in a society where I believed that watching a movie, and there are a few movies in Malayalam you have to see and you will have to cry if you're a human being, and I did not cry, and I was proud about that. And I did not know that time, of course, that it should be it's okay to cry, but I was proud not to cry. So a kid like that growing up in a society, growing into maybe 30s or early 40s or early 20s, and all of a sudden coming across a stranger with some other issues, and being tasked with expressing emotions, I think that is going to be quite what is quite a daunting task. I would have find it myself difficult to express my emotions if I was in a therapeutic setup, because I did not know. And now I am working on my own emotions, and I have much more improvement in understanding as well as expressing emotion. But I used to have experienced difficulty expressing my emotions, so I can only imagine how difficult it can be for somebody who may not have the what we say deep insight into mental health and emotions, and how it is played out in life, and what is its related to mental health. So I think it may have to do with, again, going back to Dr. Diptaru's topic, that the role the society has placed upon men, and what they should be and how they should be, has to do to a great extent with that. I have found difficulty, definitely, and I have experienced somewhere myself also, and I think this is my experience with men and expressing their emotions. Thank you.
Thank you, Dr. Noufal. I think this is also the power of narrative that we were talking about. Like when you now talk about your emotions, your experience, I'm sure many people in the audience will be able to relate to that. So thanks for sharing that. And Dia had, I think Tama was pointing out something which is in resonance with all the panelists, that we should not see care or self-care as, we should not isolate them and put them in categories, but more see as care, and which should be for everyone. Dia had been raising her hand. So Dia, would you like to unmute yourself and ask your question? Are you? Yes.
Yes. Thank you so much, Dr. Ananya. And thank you all the respected panelists. It was really a very thought-provoking and enriching talk. So I would like to share a reflection that the thought has triggered, and it has always been there, being a student of mental health. And I would like to know what the panelists say would be on this. So yeah, we have been talking about men's mental health being different etiologically, cultural conditioning wise, and even genetic makeup wise. But when we are talking about the experience of mental health, I think we also need to talk about the relative role of men and women in mental health practice. That is not only about conversations around your own personal experiences of mental health. I think mental health as a choice of vocation also sees a lot of difference across the genders. Studying during my undergrads or during my postgrads, the classes were comprised mainly of female students. And there would be just maybe one or two guy who would be studying psychology. And we really didn't pay a lot of attention to that back then. But now when I look back, I think a lot of social or academic programs need to be in place that attune young minds towards not only talking about their own mental health, but also actively participating and becoming flag bearers, so that other individuals are more comfortable or more eager and more aware to come forward and identify their own experiences, as well as to seek help when needed. So I would like to know what others think about this, if it is even a relevant observation or not. Thank you so much.
Yes, I'd request any of the panelists to please respond to that. That's a very interesting question. I was also wondering, do you see the same, same kind of gender difference in psychiatry also, Dr. Shayanth? I'm not sure. So anyway,
I have not noticed. Probably it might be my ignorance as well, but I've really not noticed.
Yeah. Okay. I think Dr. Diptarup is trying to respond to the question. Yes.
Okay. Dia's comment, more of a comment, takes me back to 1997 when I joined my undergraduate program in Calcutta University, and out of 16 people, I realized that I was the only male. Thankfully, there was another male classmate of mine who joined. So it was 2 male versus 16 female students. The ratio did not change much when I thought that change of city will do good to me. Obviously, I went to Delhi University, but there, out of 60 students, I still remember there were six male students. The scenario did not change in NIMHANS, in clinical psychology department. It's always 10 to 20%, not more than that. And now when I'm teaching MPhil, PhD, I still see some of the batches, there's hardly a single male, and some batches, it's like the representation is 10 or 20%. And that in fact, gives us a great opportunity to connect all that we have been discussing all this while. When we are talking about mental health care, mental health profession, we are talking about soft, emotionally loaded inner work, which is not seen or is visible as work, And if it's not visible as work, then there's always a question mark about how productive, how good that work is. So there's always a difficulty in improving ourselves as a real work, as a real worker, as a real profession. And I guess this is a reflection of what common people, or all of us in general, has to think about psychology as a discipline, or mental health as a phenomena. I am not aware of what is the scenario in Australia, but I'm aware of in West, the things are not as bad as this. Again, bringing the lens of both gender and culture, if we try to connect the dots, it is no wonder that work in the field of mental health or in psychology is the work of women rather than of men, because of the kind of discourse of the subjects or the kind of work that we do is reflective of that. And I don't see things changing in any way soon. And this is a reality that I think I've come to terms with 20 years back. So I'd be very surprised if I have most of my students as male students. Interestingly, faculty-wise, if you see, majority of the faculties are male.
Yeah.
And this also tells us very interestingly, when it comes to the position of power, why suddenly so many outstanding performing mental health professionals or clinical psychologists reach to their pinnacle of their career when they are far and few in numbers in their classrooms?
That's a very pertinent point again. And that also makes me think, when we think of psychologists, also famous psychologists, we talk about Freud, Skinner, Carl Rogers, all of them are males. So it's like we don't know where it is going to be in India. And yes, hopefully the entire representation might change. So we are running out of time. We have actually crossed time. So I'll just take one question, if one of you can very briefly respond to that. This is in line with what Dr. Noufal was also talking about. This is from Yudhajit. And before that, Aditi also had made a point, which is a very good point. So Yudhajit is saying that his question is about the patterns of communication that exist in Indian families. Boys are taught not to show their fears, to be aggressive, yet they are punished when they show aggression towards family members. So does this kind of double bind cause problems in later emotional expression? Anyone would like to respond to that?
Okay, I'm afraid I do not have a very clear answer still. Panelists, I think, supposed to answer something. I'm just giving my thoughts, not maybe a scientifically based, kind of thing. But what I experienced is that double bind in general, irrespective to what kind of behavior is considered to be unhealthy way of communication. So that way, if you look at the nature of communication, irrespective of what triggered it, I think it has to be harmful for the child, male or female, or irrespective of what the behavior that caused that double bind communication. And yes, this is something that I have quite many times seen, that what Yudhajit has said, that the boys are supposed to be strong, and I don't know, aggressive would be a very suitable term to use, but maybe strongly, they have to show their strength in their behavior, and sometimes the strength is shown in anger or in aggression, and that is not accepted. So even that might show probably how difficult, so you have to be aggressive without being aggressive can also be probably adding to our difficulty expressing our emotions, or dealing with our emotions. Other than that, as a pattern, this in Indian societies, that is something that I have not gone through. These are a couple of thoughts. One, double bind communication is found to be in general unhealthy, and two, yes, you are tasked with being strong, and when you show the strength that you can show the way you can, then you are punished for that, and that definitely can be a kind of misgiving and poor communication with the child, and that can be harming to the child. Other than that, scientifically valid points I do not know. These are my personal opinion, I would say, not a piece of information. Thank you.
Thank you, Dr. Noufal. Yes, Dr. Diptarup, you want to add something?
Yes, I'll just quickly say that there is another way of explaining it, and that's from patriarchy, and which is a straightforward one. So in patriarchy, it is the male, the man, the young man, or whoever is the bearer of the energy or or anger and aggression, and has got the liberty to do that. So as long as the young men of the family or the boys are showing the anger and expression, the expression of aggression outside, fear from outside, it's okay. But also in patriarchy, there is a hierarchy. So remember that boys have fathers. So you have rules and regulations. So you can show aggression towards outside, but you cannot show aggression towards your guru, that is the more senior male members of the system. So there is a hierarchy, otherwise the system will fall apart. So it's an expression of patriarchy.
Yes, absolutely, absolutely. So thank you. I think we have come to the end of our wonderful, stimulating discussion. Any last point, any last one word, or anything that you want to highlight as a take back message for our audience? I guess you all have already shared very, very important points.
I just wanted to share one thing, and which I've been trying to say all the while, because in this platform I also see possibly there are training therapists, budding therapists, aspiring clinicians there, and this in betweenness, the in between space. And I just want to leave you, and most of the generation has grown up reading Harry Potter. So in our practice, we have to find the platform number 934. And once we do that, that's the challenging one. But if we do that, that's where the creativity and it can only be done through curiosity. So stay alive with curiosity, the questions, and possibly try to figure out the platform numbers 934 in our work.
Beautifully put, beautifully put. Dr. Shayanth, any last parting comments from you?
No, nothing specific, but like Noufal mentioned, the change which I've noticed from India to Australia is that we always look from two binary concept, either male or female. But here, people who don't want to be represented to either of these groups. They like to be identified themselves as non-binary, and also to be called with specific pronouns like they, them kind of things. So we need to be very careful while even while using pronouns and addressing them. I think that is largely not kind of addressed in India.
Yes, yes, that's a very important point. And even in therapy, I think this is something we are slowly seeing, that people want to be referred with particular pronoun. And as therapists, I think we also need to train ourselves, because we are not trained to use those pronouns. So that is, of course, another discussion altogether, but I'm glad that you pointed that out, because it's a very, very important domain. So thank you, Dr. Shayanth. Any parting word from Dr. Noufal?
Just one thing, I am really glad that Dr. Shand mentioned that, I have actually started practicing, and instead of asking, gender, I usually ask this particular question, which gender you would want to affiliate, or, do you identify yourself? So that I usually ask, and I take their opinion. And to be, honest, most of our Indian clients are quite surprised, and even I think, some are quite distressed to hear the word, especially, don't you know that which gender I look like, So I think maybe something that I tell them that, I know you might have, because facial expression shows that. I tell them, yes, some people, find it, uncomfortable or sometimes amusing to be asked, but we are practicing learning to be gender sensitive, and this is a tradition that we are starting for a healthy world. So and everybody is taking, and I'm really glad that everybody is taking it very well, whether they are educated, less educated, rich, poor, it doesn't matter, and they are taking it very well. So I just wanted to share that if we present these gender binaries and men, women, mental health differences, all those things, if in a compassionate, kind way, I'm pretty sure we will be making the betterment together. And I usually keep advocating that truth can be shared kindly also. And I think even an information about gender and the differences, all those, I think we need to approach this from a kind, compassionate viewpoint. And I'm really glad to be a part of this wonderful discussion. Thank you so much for TherapHeal and Dr. Ananya and Dr. Diptarup and Dr. Shayanth. Really nice to meet you people again. Thank you so much.
Thank you. Thank you so much. First of all, my heartfelt gratitude for giving this time for such an important discussion. I know it was difficult. All of you were busy, and like Dr. Shayanth, it is night time. And despite everything, you made made yourself available. So I'm really, really grateful. For me, the take back message, of course, is, and I think for everyone, that gender, gender and mental health should not be actually the point of discussion, because mental health is genderless. And at TherapHeal, we are trying to promote #break the stigma. So I think what you all highlighted is we have to break the stigma here in our minds. And there is a power of individual voice, individual belief, and individual thought. And I really hope, like what Dr. Diptarup said, all of us find our platform 934th and we can reach there. At TherapHeal, so just again, putting together, TherapHeal is an online mental health platform. We have experienced licensed mental health practitioners, men, women, anyone, transgenders, anybody who needs, like, this is mental health is genderless. If you need help, please reach out. It is an accessible mental health platform. Our website is www.therapheal.in, THERAPHEAL. And we will also be starting our mental health posts. So we will be talking extensively. We started with this discussion, but we'll be talking extensively on mental health on our Instagram as well. So our Instagram is therapheal.mentalhealth. So I request all of you to also follow our pages. And more than that, please reach out. Please don't keep it to yourself. We are here to support. If you are looking for support, we are actually here to support. I'm extremely glad we had this conversation. That definitely is resonating with me, because we had very, very powerful thoughts being expressed. So thank you once again to Dr. Diptarup, Dr. Shayanth, Dr. Noufal for giving this time. Thank you so much. I will then end the meeting for everyone. And of course, thank you to all the participants who were so, like, we actually started off with more than, I think, 30 participants. I don't know how many were there on FB Live, but thank you for taking out time on Saturday evening to talk about this. Thanks a lot.